welcome to another episode of the Medical City South Luzon's Health Hour. So I am here again today, Dr. Claudine Gosoko, to give you another lecture or another session of Health Hour. And before we do that, I would like to greet a belated Happy Father's Day to all our fathers out there. Belated Happy Father's Day. And for this month as well, we would like to inform you or let everybody know that June is actually a celebration of prostate health awareness. So that's why we're here today, because we want to enlighten you or everybody of prostate cancer. Bakit ba natin ito kailangan malaman? Because prostate cancer is one of the leading cancer in men. So actually, dito po sa bansa natin, sa Pilipinas, ito po ay third na most common cancer among men. So, ano ba yung kailangan nating malaman? Ano ba yung dapat nating gawin? Kailan tayo magpapascreen? Okay, so itong mga questions na to, we will be learning them or the answers today. So, to educate us today, we have invited one of our distinguished urologists here in the Medical City South Luzon. He is none other than Dr. Castro to tell us more about prostate cancer. So, welcome to the Health Hour, Doc Art.
Well, thank you very much, Claude, for inviting me in your show. It's a pleasure to grab this opportunity to educate our fellow men about prostate health and prostate cancer.
Yes, Doc. So to start, Doc, our discussion, can we ask for an idea or ano ba yung prostate or ano ba yung function ng prostate, Doc, sa lalaki?
Well, Claude, kung ang babae ay may matres, ang lalaki ay may prostata or prostate, no?
Okay.
Ito ay normal na parte ng katawan ng isang lalaki. May silbi siya, no? It has a function. Yung ating tinatawag na semen or yung fluid kung saan nagsiswim yung mga sperm. Kalahati ng fluid nito nanggagaling sa prostate. So it really has a function. May silbi siya sa katawan. Yun nga lang, katulad ng ibang parte ng katawan, kapag tumatanda ang isang lalaki, may mga pagbabago din dito. So, napag-aralan na yan na pag naging 40 years old ang isang lalaki, nagsisimulang lumaki ang prostate.
Okay. Paano ba natin siya nakukuha, Doc? Or meron bang mga risk factors na nagko-contribute to men to make them predisposed to prostate cancer?
Well, yes, Claude, may mga risk factors dyan, no? It's natural na lumalaki ang prostate at the age of 40, but alam natin na kapag may parte ng katawan na lumaki, for example, yung breast ng babae lumaki, we need to investigate kung ito ba ay part of a natural process or hindi. Ganon rin sa lalaki. So, ang advice namin, kaya nga every Father's Day, during the month of June, we at the Philippine Urological Association conduct free DREs, no? Digital Rectal Examination. This is to screen men 40 years old and above kung merong enlargement at kung merong suspicious features na magsasabing baka prostate cancer ito. So, even if it's natural, it needs to be investigated. No? Digital rectal examination, ito yung pagkapak, no, sa puwet nung prostata. Ang normal kasing prostate, malambot lang, katulad ng pisngi. Pag maga ito, parang ilong, no? Medyo doughy siya ng konti. At pag cancerous, kasing tigas ng siko. So, based pa lang sa kapa, doon masasabi natin na we need to do further test kasi mukhang suspicious yung mga findings natin. Now, with regards dun sa tinatanong mo, are there predisposing factors, no? Well, age is one of the predisposing factors. The older that a man gets, the higher the risk that he develops prostate cancer. Meron nga kaming sinasabi sa urology na, you know, if you actually reach the age of 120, you probably will develop prostate cancer. Kasi as you grow older, tumataas yung risk hanggang sa point na you will really have it. So age is a factor. The usual age that it is detected is around 60. Pangalawa is race, no? If you were born with a may lahi ka na African American, no? Then you are of the highest risk to develop prostate cancer. No? In America, during the age of 60, an African American man will have about a 50% chance of developing prostate cancer. Parang toss coin na lang yun. Tayo naman, mga Southeast Asians, we have the same incidence with that of the Chinese and the Japanese. Tayo ang isa sa mga pinakamababa in the world. It's about 17%, no? So kung 50% yung African American, 17% tayo. The Caucasians, the whites, they are about 35%, no, yung incidence rate nila. So race is another one, and then of course genetics, no? If your family has a history of prostate cancer, for example, your dad had prostate cancer, a brother of yours has prostate cancer, then that makes you of a higher risk. Your risk is actually 6 times more compared to someone na walang history ng prostate cancer sa pamilya. So mataas, no? And then lastly, diet, no? They have studied a longitudinal study na ginawa dati, comparing yung mga Hapon na pumunta sa Amerika at yung mga Hapon na mga kapatid nila na nagstay behind Japan, no? So napag-alaman nila at the age of 60, itong mga magkakamag-anak na Hapon, mas mataas yung incidence ng mga nakatira sa Amerika. They approach that of the Caucasians. Nasa 35% yung kanilang incidence at the age of 60 if they are living in America. But compared to their relatives or brothers who are living in Japan, who has maintained the 17% incidence rate. Bakit? Dahil sa kinakain. It has been found out na a Western diet that is high in saturated fat, oily food, processed food, and of course, yung mga preservatives, predisposes one to develop prostate cancer.
Paano po ba masasabi ng mga lalaki na kailangan na nilang magpatingin at baka may prostate cancer na po sila?
Well, we recommend na pagka 40 years old ka, automatically you should have yourself screened. Ang mga dapat na binabantayan natin ng mga simptomas ay the same, no? Doon sa may mga enlarged prostate. Ano-ano ba itong mga to? Ito yung may pakiramdam ng retention, yung kahit tapos ka ng umihi, parang bitin, parang may natitira sa loob, no? Urgency, ito yung dati, nung binata ka, you can travel from Santa Rosa to Makati nang hindi ka naiihi, no? Pero ngayon, when you are in your 60s, parang nasa Susana Heights ka pa lang, naghahanap ka na ng gasoline station, no? Gusto mo nang umihi, parang hirap kang magpigil. And then yung tinatawag na weak stream, no? Hindi na kasing lakas ng daloy nung binata ka as compared to what you are experiencing at the present. And then yung tinatawag na hesitancy, na talagang kailangan mo ng tinutulak or iniire para mailabas lahat. And then meron naman yung tinatawag namin na frequency, no? Ang normal kasi is dapat within a span of 2 hours is mga isa lang, no? If you are more than one urination for every 2 hours, then madalas yon, no? And yung tinatawag naming intermittency, ano ba ito? Ang normal na daloy ng ihi dapat tuloy-tuloy. Pero pag yung pahinto-hinto, no? Habang umiihi ka, nakakailang stops, stop and go, then that's another abnormality that we should investigate. And then yung nocturia, yun yung pag-ihi sa gabi. Ang normal is just once, no? If you sleep and then urinate at least once during the night time, that's okay. But more than once, then we need to investigate. So yun yung mga tinatawag natin na prostatic symptoms na nakikita sa enlarged prostate na maaari ring maging early symptoms ng prostate cancer. Bakit? Because an enlarged prostate can be enlarged due to tumor, no? Kaya pala malaki dahil sa may bukol. So yun yung pwede nilang maramdaman na pwedeng maging trigger para magpakonsulta.
Okay. So, medyo similar lang din naman yung symptoms, no, for prostatic problems. Kasi di ba po, Dok, nabanggit niyo na po kanina that when we reach, or at least for men, when they reach the age of 40, there's a natural enlargement ng prostate talaga. And there's also a condition what we call the benign prostatic hypertrophy. Ito po bang benign prostatic hypertrophy? We know that it's actually prostate enlargement. Is this a predisposing condition para magkaroon ka ng prostate cancer, Doc?
Hindi naman. It doesn't
Hindi
mean na
naman.
pagka may BPH ka or benign prostatic hypertrophy or enlargement, no? Meron ka ng tendency to develop prostate cancer. Gaya nga na napag-usapan natin, ito talaga ay natural process ng pagtanda. So, although maari siyang normal na process ng pagtanda, we really have to differentiate. Is this normal, the normal kind ng paglaki, or is this the tumor kind ng paglaki?
Na-mention nyo na po kanina, Doc, yung DRE or yung digital rectal exam. Meron pa po bang other ways to actually screen?
Yes, good question, Claude. No, if you have your physical examination or your annual checkup, if you're a 40-year-old male and above, we recommend that you also request for a prostate specific antigen. No, ito ay isang blood test na kung saan makikita kung may probability na baka merong problema sa prostate o wala. It's non-specific, no? Hindi ibig sabihin pag mataas ang PSA mo, cancer na yon, no? But it's a tumor marker. Ibig sabihin, maaring mataas siya at maaring dahil sa cancer, but hindi lang dahil sa prostate cancer tumataas ang PSA. Maaring masyadong malaki yung prostate, maaring ring namamaga yung prostate at may infection. So, isa yon sa mga pwede nating blood test para malaman kung dapat ba nating imbestigahan pa, no? Or magsuspecha na may cancer ang isang lalaki o wala.
Okay, so DRE, digital rectal exam, and PSA, yung
Yes.
tumor marker test. Ito ba ay nagagamot, Doc? Or ito ba ay nawawala pa po? Pagka na-detect na, ano po ba yung treatment options ng isang lalaki po na may prostate cancer, Doc?
Okay, so ganito yung proseso, Claude, kung paano namin sila dinadiagnose, no? So kung una, may nakapa kami during the digital rectal examination na bukol, magpapatest kami ngayon ng blood test ng PSA. Lalo na pagka mataas, no? But hindi lahat mataas eh. Minsan kahit may bukol, normal yung PSA. Meron kasing mga tinatawag na poorly differentiated prostate cancer. Ito yung highly advanced prostate cancer na hindi na nagpo-produce ng prostate protease protein, yung prostate, kasi sobra na siyang naiba dahil agresibo yung cancer. Kaya akala mo, mukhang hindi dahil normal yung PSA, pero yung pala ito yung agresibong kind, no? So, well, but in general, pag tumaas din yung PSA, we proceed with the next step, which is the biopsy. Yung biopsy, it's a procedure, it's a surgical procedure kung saan pinapatulog yung pasyente, tapos may ultrasound na pinapasok uli sa anus, no, sa puwet, at makikita sa TV, no, sa video monitor yung prostate, and then kukuha ng sample na laman ng prostate. Kasi yun nga, kailangan nating i-confirm o i-verify kung cancer nga ba ito hindi. So ang normal na prostate, kasi laki lang ng kastanyas, no? At para siyang triangulo, no? At may dalawang pisngi. May kanang pisngi, may kaliwang pisngi. Pag nagbabiopsy kami, kumukuha kami ng 6 na pirasong laman sa bawat pisngi. So sa triangle, 2 pirasong tissue sa pinakatuktok ng triangle, 2 pirasong tissue sa kalagitnaan, at sa base, no, sa pinakababa ng triangle, 2 piraso din ng sample na tissue. Ngayon, pinapasa namin to sa isa pang uri ng doktor, yung pathologist, no? This is the expert sa laboratory. And then pinag-aaralan nila to, and then they will give us the score, no? Sasabihin nila yung biopsy result after their study. Ngayon, may scoring ang prostate cancer, yung tinatawag namin na Gleason score. Basically, it's 4 to 10. At the higher your score is, the more aggressive the prostate cancer. Ngayon, pagka talagang nakumpirma na positive yung biopsy for prostate cancer, ang susunod naman na step yung tinatawag namin na metastatic workup. Kasi ang tanong dyan is, okay, may cancer yung pasyente natin. Kalat na ba o hindi pa? So nagpapagawa kami ng bone scan, no? Yung bone scan is pinipicturan yung buong katawan, yung mga buto, titingnan kung mayroong kalat na ng cancer doon, no? Chest x-ray, makikita doon kung may tama na ang baga. And then CT scan of the abdomen, makikita doon sa tiyan kung kumalat na ba sa atay at sa mga kulani. Ngayon, kung sa 4 na test na ito, wala pang kalat, then it is organ confined, no? Ang ibig sabihin nito, yung cancer ay hindi pa kumakalat, maaga pa, nasa loob lang siya ng prostate. Yun yung tanong mo kung ano ba ang ginagawa namin. Pagka early stage prostate cancer, localized surgery. Operasyon po ang gold standard of treatment. So pag na-opera ang prostate cancer, it is curable. Anong ibig sabihin nito? Pag natanggal yung prostate cancer, yung prostate at lahat ng cancer cells sa loob niya, the patient is cured of the prostate cancer. No? The patient will no longer die of prostate cancer. Of course, we all die of something. But pagka nahuli ng maaga ang prostate cancer, that will no longer be the cause of death of our patient.
Pero Doc, pagka-advanced stage, sabihin natin na na-detect po natin na nag-metastasize, kumalat na yung cancer cells nga, do we also still do surgery or may other forms of treatment na po ba?
Well, may mga iba't ibang trials na ginawa para malaman ano ang pinakamagandang treatment approach sa mga advanced cancer, no? So, si Professor Messing, meron siyang kinumpara, no? Na kung saan tiningnan niya kung kapag hindi ba inoperahan yung advanced cancer compared sa inoperahan, sino ba ang mas maganda ang survival rate. So, napag-alaman niya na even in advanced prostate cancer, merong survival advantage ang operasyon. But of course, hindi lahat ng advanced prostate cancer are ideal for operation. No? Marami rin tayong kinoconsider na factors. Isa na dyan yung patient factor mismo. Is the patient healthy enough? Meron ba siyang tinatawag na comorbidities? No? Ang ibig sabihin nito, aside from the prostate cancer, meron ba siyang sakit sa puso? Meron ba siyang diabetes? Meron ba siyang hypertension? And if you take this all into account, kasama na rin yung age niya. Baka naman yung pasyente natin is nasa 90s na, no? Or 80s na. Of course, they wouldn't fare as good as someone who are in their 60s, no? Pagka-advanced age and poor health status because of really grave comorbidities, then we consider options like radiation therapy and hormonal therapy. So ito yung mga pwede natin ding i-consider for advanced prostate cancer.
Okay, so ang dami na natin na pag-usapan, Doc. Very comprehensive talaga. For our last message, Doc, meron po ba kayong takeaway message po to our audience or especially to our male audience?
Well, my take-home message for all the dads and all the guys out there is that an ounce of prevention is better than a pound of cure. So, habang maaga, no, we have ourselves screened, especially if you're already at the age of 40 and above, para if ever, kung meron man tayong problema sa prostate, mahulitan ng maaga at magawan ng solusyon.
Yes, so an ounce of prevention is better than a pound of cure. Ayan, so paano ba natin prevent? Kung meron po kayong mga naramdaman or meron po kayong mga risk factors na napag-usapan kanina, or if may kilala kayo na may prostate cancer, you can consult Dr. Castro or any of our urologists here in the Medical City South Luzon. That's all for today's session. Thank you, Dr. Art, for your knowledge, for sharing your knowledge on prostate cancer today. And we hope to see you around here in the hospital. And thank you guys for watching today's episode. This is again Dr. Claudine for Health Hour. Thank you!
Please follow our FB page and subscribe to our YouTube channel for more health videos.
And don't forget to hit the notification bell.